everyone. We are going to talk about the hidden dangers of using probiotics even for Clostridioides difficile, what we call C. diff for short. The sale of probiotics are a multi-million-dollar industry. They've gained a lot of attention with various reports and claims of treating many ailments. Your doctor, though, may not prescribe probiotics for C. difficile if the potential risk outweighs any potential benefits. So let's take a look at some of these risks. Now, there are several case reports of patients that have ended up with bloodstream infections and different infections throughout their body from probiotics. Here's a case report of a patient who received the lactobacillus probiotic and aims to prevent C. diff. And she ended up getting a lactobacillus infection on her heart valve that was replaced. She was only 24 years old. Another case report of an elderly woman who was taking lactobacillus and ended up with it in her bloodstream and also a liver abscess. Here's a review article about multiple different case reports that have come out over the years and the underlying conditions that patients had, and they ended up with different infections related to lactobacillus. These are just scattered throughout the literature of cases of patients who got infections from probiotics. Here's Saccharomyces, which is also in a probiotic. A patient ended up with that yeast or fungus in their bloodstream after taking the probiotic. Here's a review article about the Saccharomyces in the bloodstream, or fungemia, what we call, related to taking Saccharomyces. So we are quite aware of all of the case reports in the literature. Well, there are a lot of people that take probiotics and we don't see a lot of infections from them, right? So why are we seeing all these cases? Well, you might not be aware of them, but we sure are in the infectious disease community. You know, the cases are generally seen in patients who are immunocompromised, patients who are receiving chemotherapy for cancer treatment, or who have had an organ transplant, or even patients on therapy for autoimmune illnesses such as rheumatoid arthritis or lupus, even cases in patients that are on chronic steroids or uncontrolled HIV. We've seen that case of the 24-year-old who was getting a prosthetic valve replacement. She ended up with a urinary tract infection and received antibiotics, and they gave her probiotics to help prevent C. difficile. And of course, she ended up with an infection on her newly replaced heart valve from the probiotic. So it can occur in many different situations, but generally there's an underlying chronic condition. Even chronic organ failure like uncontrolled diabetes and chronic kidney disease, we've seen those kind of cases. Those Saccharomyces cases that have been reported in the literature are generally patients that have a central line in place and they're trying to prevent C. difficile. So you really need to look at what's your risk and what's your potential benefit from the probiotic. And several reputable societies have taken a look at this. There are studies that show beneficial effects, no effects, and poor outcomes like the ones we discussed associated with probiotic use. Now, the following reputable societies have sorted through all of these studies. Infectious Disease Society of America, Society for Healthcare Epidemiology Association, for primary prevention of C. diff, insufficient data, no recommendation. For C. diff recurrence, insufficient evidence. American College of Gastroenterology, not recommended for primary prevention or for C. diff recurrence. American Gastroenterology Association, conditional, depends on particular strains and then the patient's knowledge of the risk and benefits, not recommended for C. diff recurrence. European Society of Clinical Microbiology, not recommended. Insufficient evidence. Here are a list of selected references for your review, and if you want more information on C. diff itself, please see my prior videos. If you like this video and other videos that I have to offer, please subscribe and hit the like button. It really helps my channel to grow. Thank you so much.